the station that's on your side. This is Channel 7 News Daybreak.
If you haven't already heard, CBD is a non-psychoactive component of cannabis, marijuana, of course, that appears to have a wide range of therapeutic benefits. So joining us this morning to explain what those could be for you, Baptist Health Dr. David Gerson with Sherwood Family Medical Center. And thanks, Dr. Gerson, for coming in and breaking all this down. We hear a lot about it in the news recently. I mean, the passing of medical marijuana, but this is something that's not even in that class, right?
No,
it's a little bit different.
So CBD, there's no debate about it. It's part of the hemp, the cannabis plant family. And so you're getting it from pot, from marijuana. But we want to be very clear, CBD, there is no high to it. There is no euphoria. There is no reason for anyone wanting to take it to get that buzz, so to speak. But CBD has been around for years and years. It's a hot item, a hot topic right now in the United States because of all the legalization of marijuana. But what we're finding out, and we're finding out in the medical community now, we're forced to, is that CBD really does have a lot of therapeutic benefits. The big thing we're using it for with our patients are anxiety, insomnia, and chronic pain. And chronic pain can be anything from fibromyalgia to chronic arthritis to cancer treatments.
Wow.
The only issue is that CBD is only approved by the FDA for one thing, and that's pediatric seizures, which is actually a really big breakthrough for the last few years. But that also gives us some kind of permission to say, we kind of can look at those other reasons for using it, like the anxiety and the pain, those kind of things. But because it's not controlled, you have to do your due diligence, you have to do your research, you have to talk to people who have some knowledge about it. And that's going to be natural food stores like Ann's and Sherwood. It's going to be natural grocers. It's going to be online. There are some non-profit websites to deal with, and there's going to be on your website where to go to get some information to do your research. And talk to doctors that have some experience with it. It is important that you're getting a product that is pure CBD, and that you're titrating it slowly. You're not taking these huge mega doses because they are available in large doses. And the ironic thing is that most of our studies show that people get the best benefit from the lower doses of CBD.
Really? Yeah. So the lower the dosage, the better, the more the benefit, at least right now in the early studies.
In the early studies. Yeah. And so what we tell our patients who are going about it, you'll see some advertisements. There was one in the paper yesterday for gummy bears.
I saw
that's
that,
legitimate. It's legitimate as long as it's from a legitimate manufacturer. But people are taking it thinking, I want to take 100 milligrams, 200 milligrams, 2,000 milligrams. I actually start at 2.5 milligrams for the first week. And it's something you have to take every day. It's not just, I feel anxious today, I'm going to take it, or I have pain today. You've got to get it in your system. Every week, you kind of titrate it up very slowly. Most of my patients are getting good results between 10 and 15 milligrams a day.
Wow. And this is still, would you say, in its infancy in terms of studies and a lot of research?
Infancy for us.
For y'all,
There has been quite a bit of studies for obvious reasons in Colorado, California, and Israel, of all places. They do a lot of medical investigation. And so I think CBD is something we're going to be seeing even more usefulness for. The concern is again, just making sure you're getting it from a manufacturer that is giving you a pure product.
Okay. Thank you so much for coming and explaining all this morning.
Problem.
A lot to navigate through. You can always, of course, contact the Baptist Health Line with the number on your screen, or go to Baptist-Health.com